What is high blood pressure in the morning? Blood pressure fluctuates naturally throughout the day and tends to increase around the time a person wakes up. However, for many people, blood pressure may be abnormally high in the mornings. Doctors refer to this as morning hypertension. Morning hypertension can increase the risk of heart attack and stroke. These medical emergencies often occur in the early hours when blood pressure rises. In this video, we explore the causes and effects of morning hypertension. Normal blood pressure pattern. Blood pressure refers to the force with which the heart pumps blood around the circulatory system. Several factors can influence blood pressure, including stress or anxiety, physical activity, diet. When a person measures their blood pressure, the reading will appear as two numbers. The top number denotes systolic blood pressure, which is the pressure when the heart contracts. The bottom number shows diastolic blood pressure, which is a measure of the pressure when the heart relaxes. A blood pressure monitor uses a unit of measurement called millimeters of mercury to measure the pressure inside the blood vessels. Normal blood pressure is less than 120 by 80 millimeter of mercury. Readings between 120 by 80 millimeter of mercury and 139 by 89 millimeter of mercury indicate that a person is at risk of developing hypertension, while readings of more than 140 by 90 signify hypertension. Blood pressure rises and falls throughout the day and night. During sleep, blood pressure falls by 10 to 30%. It then increases around the time of wakening. In some people, this increase may be significant, resulting in morning hypertension. People who have an abnormal blood pressure pattern may be at risk of complications such as heart attack and stroke. As a 2010 review notes, the onset of stroke and other serious cardiac events peaks in the first 4 to 6 hours after walking. Causes. Some potential causes of morning hypertension include those below. Medication. Some people may find that taking their medications before bed rather than in the morning provides better blood pressure control. Others may need to split their daily dose, taking half in the morning and half before bed. In some cases, a person may need to change to another type of blood pressure drug altogether. It is important to speak to a doctor before making any changes to medications. Medical conditions. Certain medical conditions may increase the risk of hypertension. This include untreated high blood pressure, high cholesterol, cardiovascular disease, obstructive sleep apnea, diabetes, thyroid disorders, Cushing syndrome, lupus, scleroderma, kidney disease. Lifestyle factors. Certain lifestyle factors can also increase the risk of hypertension. Examples include smoking, heavy alcohol consumption, eating a diet high in salt and saturated fat, not getting enough exercise. Who is at risk? The following factors can increase a person's risk of developing morning hypertension: being over the age of 65 years, being of African or Caribbean descent, having a relative with high blood pressure, having overweight or obesity, drinking alcohol, smoking, anxiety or excessive stress, insufficient sleep, disturbed sleep, for example working night shifts. Symptoms. High blood pressure typically does not cause symptoms, even when levels are dangerously high. Certain symptoms are more common in people with hypertension. However, They do not necessarily occur as a direct result of hypertension. The symptoms include blood spots in the eyes, facial flushing, dizziness. Is it dangerous? People with morning hypertension are at higher risk of cardiovascular events than those with normal morning blood pressure readings. Getting morning hypertension under control can reduce the risk of heart attack and stroke, among other cardiovascular events.